You're watching CTOM TV. Knowledge is power.
Ed is wondering, is a CT scan the best way to tell if my cancer treatment is working?
No, the
Okay.
PET-CT is, and liquid biopsies.
Okay, so tell us a little bit about that, would you? What's the difference?
Well,
Why?
we've done quite a few things on PET-CTs and imaging and so
Well,
on.
let's assume these people have never seen
And
anything.
we will.
Okay, good.
So obviously a CT scan just looks at the shapes and the shadows,
Okay.
and it requires multiple CT scans to see if the tumor is growing.
Right.
Now, a tumor can get more aggressive and grow internally without actually increasing in size. So, your cancer could be progressing without the actual tumors growing, or your tumors could be growing and you could be having pseudo-progression. So, really getting a PET-CT will determine if there's any biological activity within the tumor. And that's the best way to determine if a cancer is responding to therapy.
Yeah, so it's the PET part of the PET-CT
Yes.
that isn't present in the standard CT scan, which, as you said, the CT scan just shows shapes and shadows. It can show there's something there, but not if it's benign or malignant or what it is. So they have to do series of tests over time.
Yes.
Whereas with a PET-CT in one scan,
it's instant, yes.
You can see if there's biological activity. Is that what you would call it? Biological activity. You see the glow that lets you know something is cancerous. And you also said something about liquid biopsies. Can you say more about that?
Yeah. I mean, if you know your genetic features and you know the driving mutations, then liquid biopsy is really the best way to go.
So if you've had some genetic testing, then you can use liquid biopsies. Can you say a little bit more about what those are?
Yeah, so liquid biopsies typically look at the tumor DNA content that is assumed to be driving your specific type of cancer. So if you have a particular driving mutation, then you can track that, and it gives you a good idea of your tumor cell burden, how many active tumors are there. It's a great way of determining on a molecular level if there's any tumor activity in your body.
Right. So you can actually use liquid biopsies to tell if your treatment is working, because that number will be going down.
Yes.
And you can also use it to show that your cancer is gone.
Yes. Exactly.
Which is pretty exciting.
Yes, it is.
Because a lot of times cancer patients wrap up their treatment, or they're prescribed, say, 12 rounds of this or 8 of this, and then when it's done, the presumption, or what they're told to presume, is okay, it's good, you're gone, or it's gone. And as you're saying, even if a CT scan is used to monitor that, that's not entirely accurate.
Yes.
So the combination of the PET-CT and the liquid biopsies can give you supreme confidence.
Definitely.
Best that medical science can give anyway.
Yeah, it's
like 99.9% certainty, essentially.
It's pretty good.
Yeah,
yes.
That's an incredible confidence, as opposed to 70% maximum with CT scan.
Yeah, it's that high.
Yeah, depends on the type.
I've seen a lot of tumors missed with CT scans.
Yeah.
Thank you for watching CTOM TV. Subscribe below and stay informed.